Hi, everybody.
We'll get started in a few. Just wait for a few more people to join. Everybody, thanks for joining. People are still logging on, so we're going to just wait a couple more minutes before we get started, just a minute or two. Okay. Gail, do you want to get started? Gail, are you on? Okay, I think we're ready to get started. Gail, you're on, or do you want to, I think you're on mute. You want to get started?
I think I'm off mute now. Can you hear me?
Yep, now I can hear you.
Okay, so I just want to say hello, everyone. I'm midtown at a meeting, so I'm not going to be able to stay very long, and it's really noisy, so I'm going to go on mute. But I want to thank you. These particular sessions have been helpful on the vaccine front and also on the recovery front. And I know that we're going to talk a little bit about both today. So I thank always the Department of Health and certainly Peggy Shepherd for everything that she knows. And I'm going to just turn it over to Jessica Mates because it's so noisy here. I don't want to keep you from hearing what's more important. So thank you very much. I'll listen in.
Okay. All right. Thanks, Gail. So we're going to get started. We are focusing more and more on issues related to recovery and reopening. But because, we see that COVID numbers are going up and we still have challenges around vaccination, we wanted to just have a quick update from the city's vaccination center, command center. So we are fortunate Chelsea Cipriano has joined us several times, and wondered, Chelsea, if you can just give us sort of a brief update around sort of what the numbers are telling us and what's the situation is with vaccines before we go into our other topics.
Yeah, absolutely. I'd love to do a quick overview. I know you have a packed agenda, so I'll be really quick. Thank you for having me, as always. It's been such a nice time with all of you over the last couple of months. Really quickly, I think, as you just said, Jessica, we are concerned about the numbers increasing. We are seeing increases in both case rates and percent positivity. Today's percent positivity was 1.72. That's a 7-day average. And then the case rate was 576, over 570 cases. That's also a 7-day average. So those are much higher than they've been in recent weeks. And I think really now is the time to really stress the urgency of vaccination. We've been talking about vaccination in this group for many months. I know I don't have to convince anybody, but really framing it around increasing rates and the spread of the Delta variant. And really ensuring we're protecting everybody, including people who can't get vaccinated, like kids, young kids right now, is so critical. And so whatever we can do to help arm all of you with the data or information or talking points to help make that case to your communities, your friends and family, let me know how we can help. Since I've last been here, I just want to make sure folks are aware of some new things on our website. So in the data page, just talking about data, we have a great tool in the zip code tab, which basically you can go look at any zip code and see kind of where the zip code is in relation to the rest of the city, in relation to other parts of the borough for both vaccination and case rates. We're hoping that this is really helpful to folks when you want to talk about like a hyper local approach. You can go look at what's going on like really granular in that zip code and how you compare. And then also we have a tab on variant data. That's obviously the topic on everyone's mind right now. We want to make sure that folks know that that information is there, data about what we're seeing in the samples that are being sequenced. Finally, just a couple of things. One, we know that a lot of New Yorkers are still not aware of the in-home vaccination program right now. Anyone over the age of 12 and older can get in-home vaccination. I'll drop the link in the chat just so that everyone has it. They can also call our trusty number, 877-VAX4NYC, to sign up. That's such a huge asset that I'm worried a lot of people still don't know about, but may take advantage of if they did know. We are, of course, always taking pop-up requests. So if you are looking for a mobile van, bus, or tent for an event coming up, let me know. I'll drop that link in the chat. And yeah, we are available to talk to folks, raise awareness, and push out good information. We also have a new video series with community leaders in various languages, getting out the stories of why they're getting vaccinated. We are hearing time and time again, besides hearing from people's doctors that they should get vaccinated, that hearing from friends and family, loved ones, community leaders is what they need to hear. They need to hear that it was okay, it's safe, and that they should do this thing to protect themselves and others and those that they love. So I'll share all of that. Just want to give a quick update. Thank you for helping us spread the sense of urgency, particularly given the numbers that we're seeing increasing. We are not letting up our efforts, particularly as it relates to vaccine. So thank you, everyone.
Okay. Thank you, Chelsea. Just maybe just a quick question, because I know, we can look at the zip code finder and we can see what the rates are, but are there any, but also at the same time, a lot of sites have closed, particularly state sites, but some city sites as well. So, are there any new strategies, vaccine strategies that you guys are doing?
I really think that we've seen in terms of uptake that people are definitely gravitating more towards being met where they are, right? Whether that's the in-home, that's the going to a local pharmacy or doctor, and then for the city sites, really moving more towards this pop-up mobile model, because people are already in parks, they're already at these events. So we're just meeting them where they are, and we've seen more uptake in that model versus people, running through the doors of the big mass vac sites now.
And are you kind of keeping track of numbers in terms of people getting vaccinated at pharmacies versus mobile sites versus other sites or in-home?
Yeah, we are able to see high level aggregates, kind of where people are going. It depends, sometimes depends on the age group. Consistently, a lot of people still want to go to a pharmacy or their healthcare provider, and we know that. For our pop-ups, we also are trying a model with providers of color, where we're bringing folks in to be kind of like trusted providers there. Folks don't have a doctor, we'll bring one to you to talk to you about the benefits of vaccine. And so we've seen good success there. We're kind of trying everything, and there has not been one size fits all model. There's no silver bullet. I hate to use bullet analogies, but so we're trying everything and seeing different uptake in different locations and demographics.
I just want to add, Chelsea, it's Gail, that I was at CUNY in the Heights this morning, and they were doing okay because they also had some things going on outside. They were doing enrollment and material about the school. That helped. And then we did the mosques last week, Friday, and we're going to do them again this weekend. What's the best idea? I hate to tell you. What's scaring people?
Tell me.
Because the variant is scaring people. And
yeah.
You're on mute, Gail.
Yep. We got quite a few people who said, I don't want to get vaccinated, but I'm scared to death of the variant. So that, I hate to say it, but that's actually a way to get people to get vaccinated.
Yeah. Sorry, hang on. Sorry. I think that we are really trying to get that notion out there that COVID is not over, right? And I think that with summer, everyone is having a great summer, but we need to remember that there are still 570 some odd of our friends and neighbors and family members getting COVID every day. And that, with these increasing numbers, the risk is still there really for unvaccinated folks. And that's what they need to hear right now, that this is not safe. And so please get vaccinated. I totally agree with you, Borough President. So, hit me with whatever you think will work and strategies, because we're trying everything.
Okay. Thank you. I see one, as Gail always says, if you are interested if you want to ask a question or have a comment, raise hand or just jump in. But I see Diana Blackwell, you have a question or a comment?
Yes, I did put in a request for National Night Out on Crime. That's Tuesday, August 3rd, to have actually a van show up. I haven't heard from anyone. Is there anything I can do to assure that I'm going to have a van there, because we're going to have lots of people?
What you just did is perfect. You have told me that you haven't heard back, and I will email my folks right now and make sure that the operations team is working on it. Thank you for raising it.
Thank you. Good. Coral, you have your hand up? Coral Dawson?
Yes, I have a question about possibly trying to do like a quick message that basically debunks all the myths and has like a link to where you can find more factual data that supports why that myth is not true about the vaccine. Because it just seems to be accelerating in a lot of areas and a lot of conversations, maybe not direct buy-in to the myth, but particularly around women's fertility. I get a lot of people, and for children and their daughters. And then we've also had, in this, I'm sure it's just circumstantial, and I'm admitting this on this call, but I'm not admitting it to my friends generally. But I also missed my period several months, which I never have ever, except for when I was pregnant, when I had the vaccine. So those sort of, and I'm of the age where that could be for entirely different reasons. But the more and more people that start sort of sharing that information, it starts freaking people out. So, I'm very happy that my daughter will get it as soon as possible. My 12-year-old son has it, but like there needs to be some sort of acknowledgement of these things happening, and maybe more data intake too. So people can say, on average, maybe some people miss their period a few months. Not a big deal. That doesn't mean you're going to be infertile or your child's going to be infertile.
No, thank you for that feedback. I think and now I've made a note particularly of that example. You're not the first person to raise this. So if there's something proactive messaging wise that we can do, I'm also hearing it from friends as well. I think it also should be
on the, when you get the questionnaire after taking the vaccine, when it asks you, how do you feel, whatever, should it say, did you miss your period? Have you had any changes in, something? Because those questions aren't even being, as far as I know, collected. And so, you know, I'm answering all these questions about like, how do I feel, better, worse, whatever, but I'm not answering anything about that. And, you know, even when I talked to my OBGYN's office, I was like, are you all collecting the data? They're like, only when people are calling in, but we have nowhere to submit.
Okay.
Okay.
Thank you.
Sorry, that's a lot, but I just feel
Okay.
like that's
No.
one that I really don't really have a
Thank
good
you.
answer for people. And
Right.
it's, you know.
Thank you.
Sure.
Thank you, Carl. We will follow up as well. All right. Any other questions for Chelsea or on the vaccine? Jump in. Okay. All right. Thank you, Chelsea. Thanks as always for coming on and answering questions and following up on all these things as well.
Of course, I'm going to do some links in the chat. I'll drop my email and then I'll hop off. Thank you so much for having me.
All right. Thanks again. As Gail mentioned, we are we are talking about the vaccine still because it's still important, but we are really moving these task forces to focus more on issues related to recovery, to reopening, and we focused a lot on budget, money coming into the city, into the state, into the city from stimulus, and how we track it, where it's going. So we've talked about, you know, housing, we've talked about education, transportation. We are very happy today to have two excellent speakers that I'm very excited about. First is Peggy Shepard, who is the executive director of REACT for Environmental Justice, is the leader in the environmental justice movement. And really wanted to hear from Peggy about sort of, is there stimulus money that's available for environmental justice issues? How do we prepare for money that comes in? What should we know about it? And anything else you want to tell us? So take it away, Peggy.
Okay, all in 5 minutes. Okay.
Or longer.
So I thought what I'd talk about is about the Justice 40 money coming from the state and federal government. Could I see hands of if you've ever heard of Justice 40? Oh no, what I'm afraid of. Okay, so Justice 40 is the Biden administration's commitment that 40% of the overall benefits of federal investments in climate and clean energy will go to disadvantaged frontline communities across the country. Now, the Biden administration made this commitment back during the campaign, and they are keeping that commitment. It's also based on the state's 40% from the Climate Leadership Community Protection Act, which committed 40% of all the benefits of energy investments to frontline communities. So the CLCPA, as it's known, Climate Leadership Community Protection Act, is being operationalized at the state level. It's got working groups, Climate Action Council, an environmental justice, climate justice group. It has a number of like 4 or 5 working groups, and they are all making recommendations to the Climate Action Council, which is permanent, on how that Justice 40 money can be operationalized. So the Biden administration modeled their plan after the state's plan. Now, what just happened today was that the Biden administration disseminated an interim guidance, which you can find on their website, an interim guidance on how Justice 40 should be administered by agencies. So there are approximately 17 federal agencies that are all eligible under this program or mandated under this program to develop programs, to develop budgets on how they will begin to enhance their programs in terms of justice and equity, and how they will develop the funding for these programs that will ultimately go to localities and to states. So what I am suggesting is that just like the PPP money went out, most of you, your small coffee shop on your corner didn't get it, at least not in the first go round. So we know that just getting money out the door does not help our communities because it doesn't go to the people who need it. By the third time, some of our barber shops and beauty shops in our community started getting it, right? Well, this is the same situation. We've got to ensure that this money coming out from the federal government actually comes to our communities in New York City and New York State. But how are we going to do that? Most of you here have not heard of it. I would hate to see the hands in the city council of how many elected officials have heard about this windfall of money coming to the city communities. So how do we begin to develop advisory boards, task forces that advocate to the city that we must review all money coming into the city to ensure that it's going to the right communities and it's being used in the right way? So even though I think this interim guidance, which you should read, you will find it possibly, if operationalized, transformative, more comprehensive than any government administration to date. Well, maybe not the Roosevelt New Deal, not sure about that, but I'm not sure about how many communities of color got in on that as well. But I just want to say that this is so important for us to understand that, for instance, if an RFP is disseminated by the government, any organization that qualifies for that should have a community partner that is funded. So I would say again, so say some money comes down for solar panels or energy efficiencies in buildings. We want to make sure that some CDC in our community doesn't suddenly be able to grab that money and then decide that they're creating a benefit in a community like Harlem or East Brownsville, or I'm sorry, East New York or Brownsville or Far Rockaways or wherever. So we want to ensure that there's a community partner that's helping to guide where that money goes, because community residents have the experience of knowing where the problems are in our community. And those of you here on the community board, I would put you in that category. You know what the problems are, you know where money needs to go, and this needs to be advised and guided by people like you who understand that. But that won't happen unless we are holding feet to the fire for all our council people, for the mayor, for our governor. It's really going to take us to do that. And so there are definitions of what a disadvantaged community is. There are definitions of what a covered program is. So this money should come for climate change, clean energy, energy efficiency, clean transportation, affordable, sustainable housing, training and workforce development, remediation and reduction of legacy pollution, and clean water and clean water infrastructure, just to name a few. So again, it's probably better if you go online and really take a look at this. It's not too long. It's probably about 13 or 14 pages. It's only an interim guidance to get federal agencies understanding what kinds of programs will be eligible, how they should compute what a benefit of an energy investment is, so that we know that dollar number. And then what the White House Environmental Justice Advisory Council is doing, and I am a co-chair of that council, we have made 100 pages of recommendations to Biden. And this guidance follows a lot of that. But again, we have told them what we think a disadvantaged community is, the kinds of projects that need to be funded, but how this is administered is the whole bottom line. And so our voices have got to be raised to make sure that our elected officials are watching out for us. So I think I would stop there, Jessica, so I don't get in the weeds, because there's a lot of weeds here. And certainly if there are any questions, I'd be happy to answer any.
Okay, thank you so much, Peggy. I know I have a couple of questions, but Coral, you have your hand up, so you wanna start?
Oh, yes. Thank you so much. And I really appreciate you clarifying what a disadvantaged community means, because that is probably very critical to this. I wonder whether it, because there are going to be so many different needs, that perhaps trying to rally a group even like this, and then community boards, again, to agree on one major one, and I'd pick the MTA, transportation. I mean, the recent rains have only further highlighted how climate change and our transportation system are not set up in a matching way. And that work really would help all disadvantaged communities and all New Yorkers, and really needs significant investment. I mean, having every station be accessible, having them all be clean, have them all work. I mean, we're so far away from that. And if we could make one major improvement in an agency that has not functioned as well as we hope it would, maybe that would be something that everyone could rally behind. And it's just a suggestion.
Let me just say that there's a danger with thinking that way. So yes, some of this money should be used for infrastructure, and there is an infrastructure bill being negotiated right now in Congress. This is to go to communities that have been disproportionately impacted by pollution, those communities that are sicker than others, those communities where because of poor air quality, you had more COVID deaths there. So this is really to address issues and poor conditions in really specific communities. Now, should some of this go to clean transportation? Absolutely. But when we start talking about benefits to everyone, what we find is why our communities are looking the way they are, because benefits to the larger society don't always trickle down to the most vulnerable communities.
I'm sorry, I may have been misunderstood in that. I meant more the stations that flooded terribly were horribly in specific neighborhoods. The ones that all the terrible footage were in particularly disadvantaged neighborhoods. So what I was trying to say is this is sort of the time to really get that all addressed now.
And that is,
sorry if I was unclear.
And there are also other federal programs like the Infrastructure Bill, the American Jobs Act, and funds at the Department of Transportation. And Mayor Pete, or Commissioner Pete, has already been to New York several weeks ago to begin meeting with people. The Secretary of Transportation, sorry, Buttigieg, Secretary of Energy, Jennifer Granholm was here a couple of weeks ago. She came to Harlem to look at some of our solar installations, the same building that our Madam Borough President came to last year when we were doing that work. She went out to Sunset Park as well. So there's a lot of activity, and we're really pushing these secretaries to get out and see these communities for themselves so that they begin to understand the obstacles to operationalizing equity and justice in all of these policies. But yes, there are going to be some issues like lead pipe replacement that impact a lot of communities, a lot of people, and are very necessary. But I just want to say that sometimes doing these broad issues that impact everyone don't always improve the conditions in the most vulnerable communities. So we just have to make sure that all of the money doesn't get used in that way.
Yeah, and that should be an oversight issue. So maybe the community boards and everything else, it's really having a formalized oversight so that they're not.
Jessica, you had some questions.
Go ahead. Diane, you have your hand up again. You want to go?
Yes, hi, Peggy. My question is, how is this plan going to impact NYCHA? Because NYCHA has two new departments, one for waste management and environmental justice. And our SWAT team is working with, we have a committee that's working with them that really is going to kind of like be a watchdog, oversee the program. So how is this going to impact NYCHA? Thank you.
And let me just cut in quickly, and Peggy, I'd definitely love to hear your answer. We're fortunate today to have Vic Bach with us also, who's going to talk about some money coming in that's available to NYCHA. But okay, just put that out there, but go ahead, Peggy.
So HUD is one of the covered agencies, and HUD money programs will probably focus on lead remediation and healthy homes. But I can't say that none of this money might not go to NYCHA. But right now it's focused on lead abatement and healthy homes. And I believe there are other lines of money focused more on the repairs that are due to NYCHA. And we're certainly working to meet with HUD to make sure, especially here in New York, where we have most of the public housing, that the HUD is really increasing those funds to NYCHA here in New York City.
Great, thank you. Peggy, just a quick question about the money itself. Do we, for the Justice 40 money, do we have any idea how much that is? And then also, is that money that goes through the state to come down to the city, or does some of it come directly to the city?
I think some will be coming perhaps directly to local and state. Some will be coming through a request for proposals to organizations or nonprofits, a variety. But right now, the agencies are beginning to submit the budgets for what they think that might look like. But again, for instance, the infrastructure bill, that is subject, all federal funds spent on climate or energy are subject to this 40%. So until we see those bills and see those appropriations, it's hard to say what that dollar number is. And of course, that's going to change from year to year as more investments, more benefits are seen as well.
Okay, great. And then I'm sorry, Monique, before, in terms of people advocating and trying to make sure that this money gets to the right place, what advice would you give? I mean, you have this amazingly successful organization and have done all this great work around, making sure that there is funding and focus on these areas. How can people do that? How can we advocate to make sure the money gets to the right place? And what's the best format and way to do that?
And that's really difficult, but I'm so glad someone just reminded me that you're all community boards here, because that is a great piece of infrastructure from which to monitor and review, for which some of our elected officials are responsible or responsive to come and report. So community boards would be a great place to happen. There is an Mayor's Environmental Justice Advisory Board. That's another place. There's a State Environmental Justice Advisory Board. Again, that's another place for review of these kinds of projects. And again, remembering that the state has the same 40% commitment. So we're blessed. Hopefully. Hopefully, we'll see.
Hopefully, we'll see. And of course, people should go to the We Act website as well to see what's going on, right? And to be able to join the movement to make sure this money goes to the right place. Any other, Monique, I see your hand. We're going to switch to NYCHA in a minute. Is your question on NYCHA or something else?
Oh, no, I guess my question was going back to, and Peggy, I'm sorry I didn't see. I'm sorry, let me put myself on video. Sorry. I liked your commentary about community boards maybe being involved, being involved in some of the oversight as the funds are coming in. So I thought that was a great commentary. I've been working with a number of our community board members, and I'm a member of Community Board 9, and we recently pulled together a proposal where we were trying to do some public service announcements in our community to help educate people about COVID and positive messaging to protect those in our community, especially now with this whole variant rearing its ugly head. We wanted to use this opportunity to empower members of our community and help them have a voice. And do you think there would be an opportunity as a community board that we could perhaps look to apply for funding and use that funding to help get messaging out in our community board?
I'm not sure.
Sorry, my question wasn't clear.
Yeah, I'm not sure that that is, would be an eligible activity. If it was around energy efficiency. So again, this money is very targeted to climate, energy, worker training, sustainable housing. So again, it's very
Oh,
narrow.
it's very specific. Okay, because we started a campaign and actually we were successful with our community board members to get messaging up on the link kiosk throughout the community and use that as a way to start empowering and educating people. But if you're saying there are particular things that the money is targeted towards, then my question might not have been appropriate. But you never know unless you ask.
Absolutely. And the Citizens Committee is a great place to get funds for that. Some of your city council people are a great place to get monies for what you're talking about. So definitely. Maybe even New York Community Trust.
Okay, I'm familiar with that organization. So thank you.
You might need a fiscal conduit because the community board's not a nonprofit, but you know, those things could be worked out.
Got you. Thank you so much.
Absolutely.
Great, thanks, Renee. Okay, any other questions for Peggy or about this the Justice 40 money or other related questions?
I see Mary and OC.
Yeah.
Hi, my name is Mary Beierbach from senior housing here in NYCHA. You were talking about climate change and solar panels. Now, during the previous administration, the Clear Water Act and Air Act was affected by the Trump organization. Will New York State maintain the higher standards of this and giving the money out regarding the air and the pollution and the water?
There should be more money coming from the federal government for local air monitoring, as well as for water infrastructure. There was a recent state bill for testing of lead in water in schools. There's been a lot of activity at the state level around that. And there's a load of activity at the city council. At least 7 new lead poisoning prevention bills have passed in the last, 6 to 8 months, with another group being ramped up to be voted on. So there's a lot of work going on those kinds of issues. And so there is money coming for that, not just from Justice 40, but from other parts of the federal and state government as well.
Yeah, I hope they maintain the higher standards.
Yeah, so the Trump rollbacks are going to be rolled back.
Oh, good.
That's the first thing they're doing. Roll back the rollbacks.
Excellent. Thank you. Anyone else? Just jump in if you can't raise hand. Anyone else questions?
Is OC?
Yeah, thank you. I'm sorry, I don't have the raise hand button. Hi, my name is OC. I'm a member of Community Board 12, the secretary of the board, and also a member of the Health and Environment Committee. My question is in regards to low-lying areas, more like NYCHA development. Is there any plan or part of this funds will include anything related to permeable surfaces to replace the sidewalks and replace the roads that paved with, replace them with permeable surfaces that will mitigate some of the flooding issues on our streets? I know it's include DOT and DEP, and it's a lot of agencies need to be involved in that, but I thought that that will be something that could be addressed, especially in areas that are prone to flooding.
So obviously, I'm not in an agency, so I can't ensure that, but I would say that there is a NYCHA sustainability plan that should address that, but there is money coming from the federal government that could address flooding issues. And then also DEP should be doing the kind of green infrastructure improvements that would again help that situation. And again, you need to stay on your city council people and your state elected officials, because there's also money there for public housing that the governor has been holding back, but I'm sure Victor is much more cognizant about that than I. But yes, there should be money for that. But again, everything is about advocacy. The squeaky wheel gets the oil. We've got to be pressing forward on your electeds, on our city DEP, and on our state as well. But there are monies available, which doesn't mean you get it without the advocacy.
Thank you. Okay, anyone else quickly, and then we're going to switch over. Okay, I see no other hands. Thank you so much, Peggy. We really appreciate that. Thank you for all those great words, and we will circulate certainly this this transcript to everyone in this meeting today, so you can remember this, and we can continue and work on advocacy efforts. So thank you very much for joining us.
Thank you.
A few people have raised NYCHA already, and we are fortunate to have today Victor Bach, who is the Senior Housing Policy Analyst at Community Service Society. Our office has worked with him on so many projects, most recently on regular meetings for a year and a half at the Fulton Houses. He's just a wealth of information. And thank you, Vic, for joining us today and letting us know what money is coming down the line for NYCHA, what we can expect or hope for.
Okay, my pleasure, and good afternoon, everyone. I assume we're interested right now in what the federal resources are that would help preserve our public housing and restore decent conditions. And there are really three channels of federal resources. The first would be the ongoing annual appropriation process. The second would be special legislation that's been passed recently in the American Rescue Plan. And the third would be in a pending, still not finalized, still rumbling along infrastructure plan at the Washington level that might or might not help public housing. But let me take those one by one. On the ongoing annual appropriation process, every year NYCHA receives two kinds of subsidies. One is an operating subsidy, which is allocated by formula to help NYCHA pay ongoing operating expenses from month to month. NYCHA is facing right now an operating deficit on the order of $300 million. It's unprecedented, and perhaps due to declining rent payments for the time being, and due to increased operating costs as a result of the pandemic. The second subsidy is the capital subsidy, which are for major infrastructural repairs. And again, that's been woefully inadequate year after year. During the last 4 years, the Trump budget proposals all sought to slash HUD funding, and in particular, end the capital subsidy for public housing. But Congress is more interested in continuity in our housing programs than Trump was, and managed to get year by year small increases in all of the programs that feed NYCHA. The third less known subsidy are Section 18 tenant protection vouchers, which help support RAD conversions and provide a richer rent stream than the rent streams that would ordinarily go to a RAD conversion. And this year, the Biden administration has proposed a small increase in the operating subsidy, but a 28% increase in the public housing capital subsidy, which is great, and virtually no increase in Section 18 tenant protection vouchers, but it's a far better initial proposal for HUD than Trump ever provided. The second area of federal resources came with the already passed American Rescue Plan. And there were two programs. One was the controversial aid to states and localities. And the other was the Emergency Rental Assistance Program for families who were backed up on rent as a result of the pandemic, and the assistance would help pay some of their rent obligations. Under the aid to states and cities, New York City got about $6 billion earlier this year, of which only 24 million was allocated by the mayor to NYCHA. A pitifully small amount, and that was targeted for a cleanup program to deal with graffiti and litter that would create thousands of temporary jobs. Again, I think that's a city hall issue that we face in terms of where NYCHA is as a priority. On the emergency rental assistance part of the American Rescue Plan, I'm not sure where NYCHA is on that score. I couldn't get information quickly enough. Public housing residents are eligible for emergency rent assistance, but on the other hand, NYCHA initiated in the spring of 2020, at the perhaps the height of the pandemic, what it calls the rent hardship program, which allowed households that were unable to pay rent to self-certify as to the loss of income as a result of the pandemic, and within a matter of weeks have an appropriate reduction in their rent as a result of the income loss. About 57,000 NYCHA households, about a third of NYCHA residents, were helped under the rent hardship program, so that literally there should be little, if any, reason why NYCHA households are paying any more than 30% of their income, even as a result of the pandemic. On the infrastructure front, there's a great deal of uncertainty. There's been a Senate bipartisan committee dealing with infrastructure, which has proposed roughly somewhere between $600 billion to $1 trillion for infrastructure, but that does not include a cent for housing. It's for traditional infrastructure, roads, bridges, highways, tunnels, and the like, and for broadband, but it does not include housing. Biden's original infrastructure package was about $6 trillion, quite a difference, of which 213 billion was for affordable housing, though it was not, and 40 billion was targeted nationally for public housing improvements. Now, you know, NYCHA's capital backlog itself is $40 billion over the next decade, and the national need is 80 billion. So even Biden's proposal came short. And the Senate bipartisan deal, the pact, will not include housing. Now, what the Democrats are trying to do is to move forward and a companion infrastructure bill which would include housing. It's unclear how much for public housing at this stage, but it would be a $3.5 trillion package. Schumer's office claims that it has more for housing than did Biden's original $213 billion proposal. So fingers are crossed that the amount allocated to public housing might be increased from 40 to $80 billion. Our delegation has been actively pressing the White House for that increase. That includes, of course, Nydia Velázquez, Senator Schumer, Richie Torres, and a number of others that I won't mention. But we still don't know whether that second package will be moved forward. It's going to be done under something called reconciliation, which means it will not be subject to the Senate filibuster, which would require 60 Senate votes to pass anything. And since the Democrats have a thin majority, it's possible if it goes through under the reconciliation provisions that the Democrats can move it on their own. But frankly, we still don't know whether there will be any money for housing in the resulting infrastructure bills. We don't know how much it would be if there is money for housing. We don't know how much would be for public housing, ideally at least 80 billion. And no matter how much is allocated to public housing, we don't know what the allocation will be to NYCHA and how much of NYCHA's $40 billion backlog would be covered. So there's still a lot of uncertainty that we hope will be cleared up by the end of the summer as these move through Congress. In the meantime, the question, I think, for NYCHA residents and for NYCHA and for advocates is once the dust settles on the infrastructure bill and we know how much NYCHA will be or won't be getting, what do we do? Where does it go? If the federal infrastructure money includes $40 billion for NYCHA, then NYCHA doesn't have to do any of the bootstrap operations through Section 8 conversions through RAD or the proposed Blueprint Preservation Trust. But the question is how that would get allocated and so on. If Washington does not provide the full 40 billion, I suspect it won't. I'd like to really be caught on that suspicion. But then the question is that NYCHA will have to continue to undertake RAD conversions and possibly the blueprint conversions in order to address the full $40 billion allocation. And where does that leave us? That it means that the future of NYCHA will involve a rather curious mixture of developments. There will be some developments that are converted under RAD, some developments that may be converted to Section 8 under the NYCHA blueprint, and some developments that will remain conventional public housing because they were covered by some funding through the federal infrastructure bill. How that needs to be planned, I think I've been trying to propose a collaborative working group that would include resident leaders, small group of resident leaders, high-level NYCHA folk, and several advocates who can be resources to really work out the next NYCHA plan once the dust settles around the federal infrastructure packages that will be forthcoming in one form or another. Whether to be optimistic or not, I don't know. Advocates are in the business of optimism, as you know, but but we'll see. And I'm just hoping that there's been a lot of controversy, some of you may be aware of it, among NYCHA resident leaders about the blueprint proposal. Certainly a lot of controversy about privatization under RAD conversion. Most of them very valid arguments. But the question is, how do we pull our sleeves to roll up our sleeves, sit around the table and collaboratively work out a NYCHA plan that has the consensus of resident leadership and the rest of the NYCHA community. And that's about where it is right now as I see it.
Terrific. Thank you so much, Vic. We're going to open it up for questions. You can use the raise hand feature, or if you have a question, just jump in. I know Hallie, you had some other questions and points that you had made. Do you want to sort of jump in to the conversation?
Sure. Yeah. No, I think. Thank you, Vic, because I think everything is so comprehensive, and this is really helpful update. I guess two questions / just kind of things I want to learn more about. One is there is this federal monitor agreement that NYCHA is working with the city and the Southern District, New York, and HUD all over like some of the major area. How is that going? And if that is going to really intersect with some of the potential federal resources coming down. And then my other kind of related question is in terms of the blueprint for change, where is your sense right now in terms of like, it needs a state legislation, to my understanding,
Yes.
to extend the public trust. So kind of where is that right now?
Okay, well, on the second question, NYCHA does plan to reintroduce the Preservation Trust in the state legislature next year. The legislation has been amended as a result of some of the responses to the original proposal. There was a lot of support in the state Senate, less so in the Assembly. That's why I think consensus is so important in convincing the legislators how to move forward on this kind of initiative. The NYCHA has if Washington doesn't come through, NYCHA has a limited number of options, and the Preservation Trust is an important one, in my mind, preferable to RAD. So we're hoping there will be reconsideration of the new legislation and much more consensus on the part of resident leadership in favor of it. With regard to the federal monitor, the monitor's focus is on several areas. One on clearing out some of the deplorable conditions that face residents, the lead paint risks, the rodent infestations, the heating and elevator outages, and the like. And some of that may or may not be addressed by the infrastructure program, but NYCHA is, and the city have committed to deadlines which have been missed over time. But the monitor is keeping a watchful eye on NYCHA's progress, which of course was stalled as a result of the pandemic on those particular areas. The monitor is also involved with NYCHA in creating what's called a transformation plan, which would be a restructuring and reorganization of NYCHA and the way it functions, which hopefully will make the system much more responsive to residents at the development level, particularly on ongoing repair orders and the like. I think the presence of the monitor has had a good effect on NYCHA in terms of acting as a watchdog on NYCHA's progress. and in terms of contributing major ideas to the reorganization of the authority. But I'm unclear. Again, I think the $40 billion includes the infrastructural work that would have to be done to meet the monitoring requirements. So we're still facing, the elephant in the room is still the $40 billion capital backlog and how we address that. I hope that answers your question.
Terrific. Thank you so much,
you.
Vic. That is hugely helpful. That's just a ton of information. I hope that was helpful to everyone. Are there any quick questions? I know Gail likes to end these meetings right at 4, so I'm going to rush, but is there anybody who would like any burning question to ask? Okay. Well, you were very thorough, so thank you.
My pleasure. Goodbye, everyone.
All right, thanks. I know there was a question in the chat around in-home testing. We'll get you the answer to that, Frida, and we will circulate, of course, the transcript to this meeting and the chat as well. So thank you, everybody. Like as I said, Gail likes to end right at 4, so we're going to stick to that. And thank you to our speakers. Thank you, Peggy. Thank you, Vic. And thank you, everybody, for joining us. And we will see you again next week.
Have a good
Take care.
afternoon, everyone.
Thanks. Bye-bye.
Bye.